I'm Dr. Chad Larson. Welcome to another episode of Keep It Real. So you can learn a lot about what's ailing people by looking at the statistics of the most commonly prescribed medications. And across the board, whether you take the statistics from a private practice physician or an outpatient hospital setting or even an inpatient hospital setting, the top three medications are analgesics, which are painkillers. They are anti-diabetic medications, so in other words, medications that help to bring your glucose down, and also medications that have a category that's called anti-hyperlipidemic. And basically think of those as cholesterol lowering medications. And so here's what's interesting. If you look at all three of those drug categories of the most commonly prescribed medications, is that they're all prescribed for medications, or excuse me, they're all prescribed for conditions that are modifiable with diet and lifestyle. But the fact that they're the most commonly prescribed medications tells you that those diet and lifestyle recommendations are not being made. So there's major therapeutic opportunities that patients need to understand that they can do short of getting one of these prescribed medications, or short of getting to the point where their physiology is totally out of control, leading to the use and necessity for these medications. So those are the top three categories of medications. But there's one group of medications that year after year always finds itself in the top 10, is a category of drug called proton pump inhibitors, or PPIs. The PPI medications come from basically four different trade names: Prilosec, Prevacid, Protonix, and Nexium. You know, the little purple pill. You've seen all the advertisements for, hey, if you're feeling a little indigestion, take the purple pill and it all goes away. So it's been heavily advertised, and as far as drug manufacturing, drug marketing, and drug sales, these groups of medications have been blockbusters. And so this PPI family of medications are always in the top 10, because what they treat is heartburn, which is a very, very common condition. And so here's the thing, is that there is a recent conference, literally just within the past couple weeks, by the American Heart Association. And there's a really interesting study that was presented at this conference. And the study was by a group of Danish researchers, and they evaluated almost 245,000 patients who have taken these medications. And they found something very interesting, is that the individuals who are taking this medication for heartburn have an over 20% increased chance of getting a stroke. So strokes are one of the most common killers in the US. It falls under the category of cardiovascular conditions, and we know that cardiovascular disease is the number one killer in the US, with strokes being part of that category. So it's a major killer. And by taking this medication for heartburn, it increases your chance of getting a stroke by over 20%. And that's the average. If we pick on one of the medications, which is called Protonix, if you take this medication, you have about a 90% chance increased chance of getting a stroke. So the generic name of these medications end in azole, A-Z-O-L-E. So they have different names, like omeprazole is one of them. And so they usually group these drug categories similarly, and they've got a similar last last part of the name. And so if you're taking one of these medications, it massively increases the chance that you're going to get a stroke. And so here's the deal, is that there's lots of other tools that should be in the tool bag for heartburn. So heartburn, just let me explain a little bit about heartburn. One of the key points of this show is to demystify medicine and to demystify human physiology. And here's what happens is stomach acid is supposed to stay in the stomach. The stomach has a very robust layer of mucus, and this mucus layer protects the cells of the stomach from getting irritated. And so there can be a very, very high acid level in the stomach, and you don't feel it. You don't feel any symptoms or anything. But what happens is heartburn is not too much stomach acid. Contrary to the way it's treated, meaning the treatment is to stop stomach acid. That's what the proton pump inhibitor medications do, is they stop all production or massively stop the production of stomach acid by blocking the cells in the stomach that make stomach acid, the proton pump. So what happens is the stomach makes this acid, and this acid is vital for breakdown of your foods. And we're supposed to get all of our nutrients, our proteins, carbohydrates, fats, and all the micronutrients like minerals and vitamins from our food. But they require a certain amount of digestion and breakdown that happens high up in the stomach. Digestion actually even starts in the mouth. There's even enzymes in the mouth that start to break down the foods. But then as it drops down in the stomach, some serious digestion takes place, and that's where there's digestive enzymes and stomach acid. And so by taking one of these medications, it blocks the acid that's supposed to be available to break down your foods. So if that happens, that can leave you with some potential deficiencies and insufficiencies of certain nutrients that are supposed to require that acid. So just on the face of it, taking this medication should be extremely short term, and it's not. And there should also be some other management to help figure out why a person has heartburn in the first place, which is also not really done. So what happens is stomach acid is made in the stomach and it should stay there. But what happens is heartburn is acid not being overproduced. It's just acid in the wrong place. And so what happens is there's a muscle in between the stomach and the esophagus called the lower esophageal sphincter. And what this muscle is supposed to do is keep stomach acid in the stomach. But in heartburn, what happens is you get relaxation or opening of that lower esophageal sphincter. We call it the LES. And then you get stomach acid that splashes up into the esophagus where it's not supposed to be. The esophagus does not have the important mucus layer that the stomach has to buffer it from the acidic effects. And so when acid splashes up into the esophagus, it can be very, very uncomfortable. And in some people, the acid travels all the way up to the throat, and it could give a person sore throat. It can make them cough. Some people can even get what they call microaspiration, where you actually inhale a little bit of that acid, and it could even induce things like an asthma attack. So it's a big problem. And when heartburn is happening in a chronic way, and chronic medically, what we mean by that with regard to heartburn is 2 or more times per week. If you get heartburn 2 times per week or more, it's considered a pathology. And that pathology is called GERD, gastroesophageal reflux disease. And GERD is the indication by a medical doctor to prescribe one of these PPI medications. But now that we've learned that PPIs significantly increase your chance of a stroke, I think you should start to consider, and the physicians should start to consider, some other options. So the bigger answer to the question of why does a person have heartburn, or how do we treat heartburn, instead of just giving a heartburn medication like a PPI that shuts down acid, it's more like, why is that LES, why is that lower esophageal sphincter muscle relaxed and open and allowing the acid to splash up into the esophagus? That's where the treatment should be. And so there's multiple things. Here's a few things to consider with relaxation of the lower esophageal sphincter. One of them is eating too much. If you eat so much, we call this a mechanical relaxation of the LES, meaning there's so much food in the stomach that it causes pressure on that LES muscle, causes it to open, and that allows acid to then creep up into the stomach where it's not supposed to be. That's one. Another one is a high fatty meal. Think of, like, you know, deep fried foods, like French fries, or tortilla chips that are deep fried, or taquitos, or anything that's deep fried is loaded with this kind of fat that can cause relaxation of the LES, which can lead to heartburn in certain susceptible individuals. Another thing is spicy foods. Spicy foods are also a well-known trigger for heartburn because it causes relaxation of that LES. Some other things are citrus foods, like lemons, that kind of thing, in some people can cause heartburn because it relaxes that LES. Some other things are dairy, and certain mints like peppermint, spearmint. Again, in certain susceptible individuals, these mints can relax the lower esophageal sphincter, leading to heartburn. So just from a preventive standpoint, so that the need for those medications is dramatically reduced, consider which of those foods you may identify as a trigger for you causing this type of heartburn. Another category of triggers are food sensitivities. So those foods that we just talked about, like citrus and spicy foods and that kind of thing, are just known foods that cause heartburn because they relax that lower esophageal sphincter. But there's another problem with foods in certain people, and that's a food sensitivity. So a person has an immune reaction to that food, and that could also cause relaxation of the esophageal sphincter. And I think the common culprits would be gluten and dairy are two top foods that can lead to this type of situation. Also certain nutrient deficiencies like zinc. Zinc is needed for your stomach to make hydrochloric acid, to make the stomach acid. And if zinc is deficient, which is surprisingly common, then there's going to be a reduced ability for the stomach to make hydrochloric acid because it's missing this important cofactor, zinc. And so in some people, just by taking zinc, that'll help to improve their production of stomach acid. So isn't it ironic then that people who have zinc deficiency might also be taking a medication because they have stomach acid issues that further blocks more acid that is required to absorb zinc from your system or zinc from your foods. Because check this out, sometimes when a person gets heartburn, it's not just because of too much acid splashing up into the esophagus It's actually an acid deficiency. So watch this. When there's a deficiency of hydrochloric acid or stomach acid, what can happen is the food, because it's not being broken down in the stomach, it just kind of sits there in the upper part of the stomach and it ferments. And this fermentation process causes a gaseous acid to creep up through the esophagus. So not only are they being treated with an acid lowering medication, but in fact, it's a low acid situation that put them there in the first place. So there's multiple things to consider when somebody has heartburn. Another thing is certain medications. There's a list of medications, so if you're on medications and heartburn is a common symptom for you, you might want to ask your doctor or pharmacist, or even look up on the internet if heartburn is a common side effect of the medication that you're taking. It could be that simple. Of course, that might not be simple if that medication is really important for your health, but there could be certain medications just to have that on the list of things to consider that can cause heartburn. So it's all about different triggers that lead to relaxation of the lower esophageal sphincter. That's the take-home message. And that's where the treatment needs to be, is trying to identify certain triggers that cause relaxation of that lower esophageal sphincter. And one more to put on the list is certain infections. There's a pathogen called Helicobacter pylori, or H. pylori. And this is a bug that kind of drills itself down in your stomach, and it could shut down stomach acid. And so if those other things, certain foods or certain medications or certain nutrient deficiencies don't really pan out for your system, it could be that you've got this underlying infection. It's a pretty common infection, and it's very simple to have diagnosed by your doctor. So if that's something that you're considering as a potential trigger for you, then you can easily get that checked out and treated. So, I take it as an important obligation for me to share this information that comes fresh out of research. And this is as fresh as it gets. This research was just finished and presented at an American Heart Association conference, and it's huge. It should really change the way that us physicians consider prescribing these proton pump inhibitors, because by prescribing this medication, what we're saying is we are increasing your chance of a stroke in a really significant way. And we need to consider, is it worth it? Or would it be more worth it to try to identify one of these underlying causes that lead to the heartburn in the first place? And so I hope you've learned something. And if you're one of the people that fall into this category, and believe me, there's millions of people in the US who are on these proton pump inhibitors. So chances are you or someone you know are on one of these medications, and I would strongly consider looking for an alternative form of treatment. So thanks again for joining me in this episode, and we'll see you next time. Until then, keep it real.